Well, since the longest day on Saturday has passed, it's now Wednesday, so 5 days later, a lot's happened. Tuesday was our halfway point for radiation. That was yesterday. He was not feeling well at all. When I went up at 10:30, he was sound asleep, and he woke up in time to be picked up by his sister at 2:30. About 2:15, I saw him on the bottom of the staircase, waiting for her to pick him up, and he looked very ashen, very gray. Didn't look like he felt very well, and I asked him how he was doing. He said not good at all. He couldn't swallow, and since the evening prior, that'd be Monday evening, he ate mashed potatoes and meatloaf that I had made for him on Monday night. But as of late Monday night and all day Tuesday, had consumed zero. No fluids, no food, no nothing. We had a point like this in the chemo the first round. So I would say have something like Rincinol, R-I-N-C-I-N-O-L. It's a very viscous fluid that you can rinse with. He can't use the Magic Swizzle, the mix of lidocaine, Pepto, and whatever the other thing is. He can't take that. So he really thought that if he didn't get fluids, he was going to need to be admitted. He knew that today we were going to get disconnected, and at chemo, they'll give you fluids. At radiation, they don't have that ability. So he was also to have an appointment with his eye doctor for his macular degeneration treatment last evening, and I talked to him, and I canceled the eye appointment. I called ahead to radiation and said he may want to go to the ER for fluids or whatever the doctor would suggest. We weren't sure if he was just dehydrated or anemic, and he had just gotten blood on Saturday, but he looked so gray, and he had absolutely no energy. So they went to radiation. I canceled a patient and moved a couple, and was able to get right up there just as they'd left radiation and gotten to the ER. They were still just checking into the ER, so I was with him the rest of the time yesterday. In the ER, they did labs. His hemoglobin was 10.4, so it was not anemic. It was just dehydration. And instead of giving him just a small amount of fluid, they ordered 2,000 cc's of fluids. So he ended up taking in probably about 1,500 cc's. They also gave him an IV dose of the Rocephin, which was the antibiotic for the urinary tract infection. And because he had better results with the IV Rocephin than he did with the Bactrim, which they prescribed, they changed the prescription. So today I'll go drop off the prescription for Keflex. Rocephin is an IV drug, but in the same class. So I'll drop off the prescription for Keflex. I'll pick him up. I'll take him to chemo. Today, his chemo gets disconnected. Today, we're finished with chemo. So I'm sure that that in itself will feel like a milestone to him. Looking forward to that. They'll also do labs. I'm not worried about his hemoglobin since I know what the number was yesterday. I'm interested to see what his weight is because he is definitely losing weight. Like to keep an eye on that. We will go back to the popsicles. I know he was going to go home and have a popsicle. Those were a very good treatment the last time we had this sore mouth. It's like the whole lining of his mouth wants to slough, even though they're only radiating his abdomen. I'm pretty sure it's chemo related to the 5-FU, which he does for 120 hours. That just makes the entire surface of his throat and mouth slough off in one giant piece, he explains. So today, hopefully all goes well, and that's where we are. Thanks for keeping us in your prayers, and huge shout out to all the patients that let me move their appointments. You guys are the best.